share your video. We're going to be doing a little lip filler and a little bit of the wrinkle relaxer, the Botox Dysport Xeomin, and we're a little over a year from the lift. How are things feeling with the lift?
Oh, absolutely fantastic. I'm so happy that I did it.
You look so good. And she's such a great smiler. We love it when Susan comes in because she lifts us up and makes us feel good. And you can see in her pictures from her profile and jawline what a nice improvement. And now we're just going to do a little plumping and some of the wrinkle relaxer. So really proud of Susan. Now, for the physicians and students that are watching, I like to use the HIPAA cleanser. Let me have you rest your head all the way back. It's very rare that you're going to get an infection from this, but we still do the cleansing protocol. We'll do the labella, forehead, and then crow's feet. I like to do the wrinkle relaxer a little differently, that I do some over the lateral tail of the brow, because you want to prevent that extra arched look. That's what everyone, the severe brow, we're not going to let that happen. And I tell patients for the Botox Dysport Xeomin that if they need a touch-up, you need to give it a couple of weeks before you add more, because you don't want to just waste the product by just adding more when it takes almost a full 2 weeks to get the full effect of it. So Susan's a pro. She was very happy with what she's been doing, and she was noticing how it's been lasting a little bit longer, which is normal with the Botox Dysport Xeomin, because the more you do, it weakens the muscle. You can see that it takes a little longer for it to dissipate. So that's a good thing. Now I'm going to do some numbing around the lips. I'm going to lift here, and then you'll feel buzz. Pinch on 3. 1, 2, 3. Pinch. You feel small, medium, big pinch there? Not too bad? So I go slowly. This is a modified dental block. It breaks my heart a little bit when I hear from patients that they had lip filler or filler and that it was super painful. Little pinches are fine like this, but once you're numb, you really are going to get your best result with the filler, because you need to be able to hold still and be comfortable. You feel small, medium, big pinch there? Okay, so she's not feeling it, or she'll feel just a little tiny pinch, but this is the right way to do it in my opinion, and it still maintains the proportions and the anatomy of the lip, so you can do a good job plumping. We'll do a little plumping, we'll treat a little bit of the fine lines. Susan is the A+ student looking for extra credit, so we're going to keep a little pinching there. We'll keep her safe, make sure that she looks natural. We want to prevent the future aging and get as much improvement as possible. And that's a part of our ABCs of plastic surgery, right? 4 areas, the A for areas of cosmetic treatments. When you know the ABCs, you'll make your best decisions. You feel a little pinch there? A stands for area. We're either, number 1, we're sagging, so we tighten. We did the lift for Susan. Number 2, we lose volume. We're doing some filler today. Number 3, we get sun damage, wrinkles, and sunspots. We're doing some of the wrinkle relaxer, and of course Susan's doing her sunscreen, sun protection, and skincare at home. And all of our patients, we recommend they meet with our esthetician for skincare analysis and a customized treatment plan. That's the best we can do while we're at home for our skincare. The 4th area, I'm going to lower your lip here for our appearance, and go ahead and close your mouth for me. Thank you. Buzz and then pinch. 1, 2, 3, pinch. The 4th area is better than everything else. That's our behavior. And nothing looks as good as Mother Nature's free face-up when we smile. And Susan does a lot of smiling. And that is our model when you are smiling. That shows us what we want to recreate, plumping in the cheeks. And we've done a little bit of filler, but now we're focusing on the lips. It's very natural that we thin in our lips and get the creases around the mouth as we get older. Very, very natural. So now we're just reversing that, right? We're turning back the clock, filling in what has changed. Everything's looking good. How are you doing, Susan?
Good.
Now, when you do the numbing here, it's important, right? We've got to make sure we're blotting the lips, and you tell the patient there's no drooling, because they may feel like I'm drooling, but they're not. So you got to let them know and stay ahead of that. Now, I'm also going to test.
I feel this big.
Yeah, this is just the numbing. The numbing makes the lips feel big. So I'm going to do a little testing through here. Do you feel a little bit of a pinch here? Not too bad? Everything's looking good. Little pinch there. So a little extra numbing, just testing and making sure we're giving enough so that she feels very comfortable. Now I'm going to blot and then corner of the mouth, you feel pinch, 1, 2, 3, pinch. The corners of the mouth, they downturn, little pinch here. And we want to stay ahead of that for sure. 1, 2, 3, pinch. And pinch. Perfect. So we're using, this is the Restylane L. I like to use a 32 gauge needle. What's amazing about that, it is 0.2 millimeters in thickness, and that's so tiny. That way that you feel less and there is less bruising. So first I like to start out in the corner of the mouth because that's an important area to build up. You feel a little bit of a pinch there, not too bad?
Not too bad.
So the corners of the mouth, we hollow and we want to turn that up just a little bit. Just got a little bit of a crease there, a little pinch. So I'm just going to fill that area just a little bit. And this is an intradermal injection as opposed to a subcutaneous injection. So just touching these little fine creases. Takes really good vision to see these. Of course, we never see ourselves the same way that other people see us. So we are going through our ABCs of plastic surgery. The 4 areas: tightening, volume, skin, and then behavior. That's what we treat. That's A for area. B is for boundaries. What are the rules for good cosmetic treatments? Safety is always first. You must look natural. Number 2. Number 3, you feel a little pinch. Let's prevent future aging changes. Number 4, let's get as much improvement as possible. Now, we can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, it's better than going too far. But those are the boundaries, the rules for good plastic surgery. And then C stands for combination. Feel a little pinch here where I see the little creases, little pinch, little pinch. If you want your best results, we combine, which is what we've done for Susan because she's done the lifting and tightening, and then we're also adding some filler. How are we doing, Susan?
Good.
Doing good. The lips are going to feel goofy while they're numb. I'm just filling these little creases. So combination treatments always do the best. If we want our best results, but we just want to do one treatment, then we're talking about lifting. And if we want our best results with no downtime, then we're talking about filler. Fillers do a great job, but they don't give us a lift. And lifting, we get wonderful results, but I can do even better when I combine. So if you understand those categories of combination, solo treatment with lift, and then fillers, you're going to get, if you're happy with your results, then great. But if you want more results than what you've achieved, you know the next step you need to take, right? This way you see the future. Now, of course, Susan has many active years ahead of her, and we want to make sure we keep her safe. Yes, the good Lord willing, and she's the A+ student looking for extra credit. So those are the rules that we go by, right? The 4 areas, the 4 rules for good cosmetic treatments. We're using combination treatment to get her best results, that she looks natural. It is important to keep in mind that we never see ourselves the same way that others see us. Sometimes we can be a little hard on ourselves, and we see the photos. If we see a photo of a beautiful person, usually they got really good lighting. Usually they took how many pictures before they found the one that they liked? It's usually a lot. And then we hold ourselves to that standard. Being too hard on ourselves is the reason why people go too far. Happens all the time. Not going to happen here. We're going to protect you from that. But that's why you want a great doctor to make sure you don't go too far. And it's important to not be too hard on yourself. So these are all the things we talk to our patients about so that they can get their best results. We're on a mission to stop bad plastic surgery and do things the right way. How are we doing, Susan? You doing all right?
Doing great.
Everything's looking good. Perfect. Her family and friends, they won't figure out what she had done. It'll look very natural. She'll pass the grocery store test today. You walk into the grocery, no one does a double take, but now everybody's wearing masks, so she's really going to pass the grocery store test. I need to do an analogy since the grocery store is so different nowadays.
Mm-hmm.
Everything's looking good. So this 32 gauge needle, a lot of providers, they'll use a bigger needle. They're going to traumatize the lips more. So 32 gauge I think is the best way. You can use a cannula for lip treatment, but I think this is a better way to go because as you can see there's very little significant bleeding. There's trauma if you're going to push that cannula through the tissues, and it's a bigger cannula. This is a tiny 32 gauge needle. So I'm going to show you what we've done so far. Now the lips feel big because of the numbing medicine, but can you see? I know. Can you see how it's just outlined the crease, right?
Mm-hmm.
How does it look so far?
Good.
Do you think you want a little bit more in the substance of the lip? It doesn't go too much. I can just put a little touch through there, and then I'm going to do some in the creases. How does that sound? Okay. I always like to check in and make sure that the patient's happy with what we're doing, and that there's not a surprise. They say, "Wait a minute, is that too much?" But we go slowly, so that's not an issue. We have you rest your head all the way back. So just a little bit in the substance of the lip through here. This is just submucosal, very superficial. That's important so that you're not getting into the blood vessel. In small amounts, it's hard to get into trouble using small amounts over a large area. Perfect. Very good. There's always a little more lip show on the bottom, 2/3 on the bottom, 1/3 on the top. Everything's looking good. Perfect. And we get these little creases in our lips across the way, so this is just to help to plump out, to fill in. And we got this little crease here, little pinch. And the smile lines, right, we can't get rid of the smile lines 100%, but we'll do our best to soften them. Perfect. Little crease here, pinch. The hyaluronic acid, I call it the fine line filler. It actually does a better job than the other fillers. And it lasts about a year, so we use it exclusively in the lips and for finishing touches. A little bit through here. Give us a call. We're happy to give you a plan on what's right for you so that you can look natural and not go overboard. We love to give to the givers. People, we're such a really generous and giving society. We give to our family, give to our work, our friends, and now is the time more than ever that we really do need to give to ourselves so that we can feel good and do good by others. We can't pour from an empty cup. Right? We need to fill ourselves up. And Susan's good about that, investing in herself so she can be there for others. Okay, so we've done the lip filler. I'm going to do some of the Botox Dysport Xeomin, and you can see it really doesn't take that long to do. It's very quick. You feel buzz and then pinch. 1, 2, 3, pinch. 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 Doing okay?
Mm-hmm.
She's tough. And the crow's feet, I'll use a couple units here. 1, 2, 3, pinch. 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 One, two, three, pinch. 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 And then a little left for the forehead. Raise your eyebrows up real high for me. Now relax as best you can. I like to go a little higher on the brow. That way you don't want people feeling that their brow drops. The brow may drop a tiny bit, but the higher up you go, you're going to have less of that effect. So this is a part of the artistry of the Botox Dysport Xeomin. And then laterally here, I'm just going to use about half a unit. 1, 2, 3, pinch. 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 I'll use about a unit. How you doing, Susan?
Doing good.
Pinch. Pinch. And then another half unit up here. And then half unit here. Pinch. Pinch. Okay, we're completely done. Hopefully that wasn't too bad.
It's hard to talk.
It's hard to talk. That's the numbing medicine, like you've been to the dentist, but no root canals.
Oh, thank
So
goodness.
let's take a look here. So the numbness lasts for about 30-45 minutes. No restrictions. We'll give her some ice, but it's not mandatory to ice. You can just ice until the ice gets warm. Now, if you feel a firm area, you can just massage. There's no restrictions, but it looks good. It looks natural. Any questions?
Nope.
Okay. Very proud of you. I give you the
Thank you.
hugs from here. Now again, you're heading
Now,
straight.
do I have to massage this?
Only if you feel a firm area, you can massage it
Okay.
down. And you're heading straight to work.
Yes.
So here we go. She's going straight to work. No downtime. Thank you for watching. We're on a mission to stop bad plastic surgery. We're here to help you raise your standards. Please share the video so you can save a friend and make sure that they have a good cosmetic outcome. We'll see you in the next video. Bye-bye. Great job.
Thank you.
Okay.
You're
So can
welcome.
we give her a little bit of ice, please? Let's see, is that one? I'll help you out with that. Yep, that's perfect. Hold on.